Alright guys, this is another video for cranial ultrasound. This is a little bit of cranial ultrasound potpourri, a little bit about hydrocephalus, a little bit about structural abnormalities, a little of this and a little of that. Hydrocephalus, this is what you guys will frequently say is extra fluid in the brain, dilated ventricles, etc. Hydrocephalus is when there is too much fluid and dilation within the ventricles, the lateral ventricle, the third ventricle, the fourth ventricle. This can be due to several things. Maybe the baby had a hemorrhage and the blood that's in the ventricles is obstructing the flow of fluid. Sometimes there's structural abnormalities that cause a blockage of the normal fluid pathways. There's a variety of reasons that you could have hydrocephalus. But basically it boils down to, it means that the ventricles are bigger than they should be. And this is usually judged by a subjective measurement or a subjective assessment where we'll say there's mild hydrocephalus or moderate or severe. So here's a couple of examples. We see that there's enlargement of the lateral ventricles, the third ventricle, these structures down here inferiorly. These are the temporal horns of the lateral ventricles. These are very good areas to look at in terms of hydrocephalus. These are very sensitive early indicators of hydrocephalus because they dilate earlier than other parts of the ventricle. And so if you see that these areas of the temporal horns are getting dilated, that's a very good indication that there's hydrocephalus. On the sagittal image here, you can see that here's your third ventricle. That's bigger than it typically would be. And then here's your fourth ventricle, probably okay in size. There are a couple of more objective measurements of hydrocephalus that can be used. As I mentioned before, most of the time we give a subjective mild, moderate, severe hydrocephalus, but the NICU in particular would like us to give some objective measurement. So one that we commonly use is what's called the Levine index. This is taken from this website. But the Levine index, which we can use up to 40 weeks of gestation, is just a measurement from the midline of the brain on the coronal images out to the most lateral part of the lateral ventricle. And there's charts that they can use, they can look up online to say for a particular gestational age, the Levine index or measurement should be X amount, and then they can say use that to say if the ventricles are larger than they should be or not. Another measurement that we can use after 40 weeks of gestation, again taken from this website, is what's called the ventricular index, which is basically just a ratio of the distance between the most lateral aspect of the lateral ventricles compared to the overall side-to-side measurement of the brain. And you can see how when there's hydrocephalus, like in this case, that ratio will go up. The width of the ventricles in the hydrocephalic patient is significantly larger than in the normal patient. Another common thing we're looking for in NICU babies is what's called periventricular leukomalacia. What it is it's an ischemic lesion or insult to the baby's brain. Maybe they were hypoxic for some reason, they didn't have good blood flow for a period of time, and in essence it's an area of stroke basically. In premature babies, the area that is affected by this is the white matter that's adjacent to the lateral ventricles, so that's why it's called periventricular leukomalacia, and it affects the white matter in the posterior part of the brain most commonly. So what will it look like on ultrasound? Well, it may be normal right after the event happens, but after a period of time, maybe within the first couple of weeks, what we may see is that the architecture of that white matter will increase. Remember we said on previous videos that the choroid plexus is normally the most echogenic structure in the brain. If we see that the white matter is becoming as echogenic or more echogenic than the choroid plexus, then that's abnormal and it can indicate the PVL. PVL can be symmetric, it can be asymmetric, it can be patchy or diffuse. So really the most important thing is to be looking for areas of echotexture that are higher than the choroid. And then down the road, maybe 2 to 6 weeks after the ischemia takes place, that increased echotexture can either resolve or it can progress into these extensive cystic changes. Here's an example of cystic change in PVL on a patient here at UK. You can see extensive cystic change within the periventricular white matter, and this is really pronounced periventricular leukomalacia. Another abnormality that we sometimes encounter is what's called mineralizing vasculopathy. This is basically calcification along blood vessels, and it characteristically happens in these deep portions of the brain down here by the thalamus, by the caudate nucleus, and this is what it looks like. You get these branching linear areas of increased echotexture that represent mineralization along blood vessels. If you see this, one thing you can do to help confirm it is to put Doppler on and see if there's blood flow in these structures. Sometimes we're able to see it, sometimes we're not, but it can be a helpful thing to do. There's a wide variety of abnormalities that can produce mineralizing vasculopathy. Most commonly we get concerned about what are called torch infections, which are like the rubella, cytomegalovirus, herpes, HIV infections, things like that, that some babies can acquire when they're in the womb. A little bit about structural abnormalities. This is a classic look for a particular structural abnormality. If you remember from the anatomy video, these are your lateral ventricles here and here, and normally just above the lateral ventricles we would see a hypoechoic band which represents the corpus callosum. In this patient though we don't see that. We're missing that hypoechoic band, and the lateral ventricles are more widely spaced than they should be. This is what's been called the Bullwinkle sign or the Texas Longhorn sign, whichever you prefer. But this is a classic look on the coronal images for agenesis of the corpus callosum. Other abnormalities that we get with agenesis are that the lateral ventricles kind of get this more parallel configuration than they normally would, and the posterior horns get kind of dilated. That's called colpocephaly. When you look at the sagittal images, again, we don't see the normal corpus callosum like we would in this area, and the gyri of the brain kind of go all the way to the roof of the third ventricle here, and that's because the corpus callosum is not in the way to block those things. This is a case of Chiari II malformation. We get these pretty frequently in the babies that have myelomeningoceles, but this is a very good classic case of what a Chiari malformation looks like. We get an abnormality of the lateral ventricles such that the inferior tips of these lateral ventricles become very tipped or beaked, and again the posterior aspect of the ventricles get kind of dilated. Again, they get that colpocephalic configuration like we saw in the last case. On the sagittal images, this is down here in your cerebellum and vermis area. In a Chiari II malformation, the area that the cerebellum is in gets much smaller. It's a much smaller space, and so we can see that it looks like the cerebellum's kind of squished in. This is all the rest of the brain up here, and it looks like the cerebellum's kind of squished into a tiny little space there. So that's all in keeping with the Chiari II malformation. This is a nice case of a Dandy-Walker malformation, which is another fairly uncommon structural abnormality, but something that we're able to see with ultrasound. A Dandy-Walker malformation is a big cyst next to the cerebellum that then communicates with the fourth ventricle. You can see it really nicely here on these mastoid views. Here's your fourth ventricle, and then you see that the fourth ventricle is communicating with this big cystic space in the posterior fossa. And so again, this was a Dandy Walker malformation. The patient got an MRI that confirmed it. All of these structural abnormalities were, it's nice that we can make these diagnoses off cranial ultrasound, but ultimately, all of these patients will need MRIs to really get the best look at these abnormalities and really assess them fully. So that is it for this video.